Hey guys, I know everyone is talking about the one big beautiful bill and all of the changes that are rolling out as a result of that. But I wanted to take a minute today and talk to you guys about some interesting Medicare news that I haven't seen a lot of people cover. And this is really concerning to me because this wasn't part of that big legislation that's got everyone's attention. This kind of snuck in through the press releases and the things that we see from other sources. So I'm not sure if anyone knows what's going on here, but I was just going to ask you really quick, does Medicare ever confuse you? Because I know that it can be wildly confusing, and I would love to hear your perspective on that as we dive in here. So here's what's going on. Starting in 2026, the government is going to start testing out some new technology to help improve, the standard thing, right? Waste, fraud, and abuse is what they're going to be fighting with this. And it's effectively going to slow down or deny certain care, even in traditional Medicare. It's called the WISER model. And, that name sounds great, right? Like, WISE sounds great. But the goal of this really is just to implement those prior authorization requirements that can make it so hard for people with insurance to get the care that they need. So, today we're going to cover two different types of changes that are coming. We're going to be talking about the implementation of WISER in traditional original Medicare. And then we're also going to talk about some pre authorization changes that are coming to Medicare Advantage as well. So if you get any form of Medicare, this video is going to be relevant to you. So let's just dive in here. So when they rolled out the WISER model, what they're saying is, waste accounts for up to 25% of US healthcare spending. Medicare is wasting billions of dollars on low value services. And the interesting thing here is, they're targeting what they're calling low value services, right? So this is a quote from Abe Sutton, who is the CMS Innovation Center director. And he's saying low value services, such as those of Focus and WISER, offer patients minimal benefit and in some cases can result in physical harm and psychological stress. They're also increasing patient costs and inflating healthcare spending. So basically what they're saying is, Medicare is spending too much money on these low value services, and they're not really clear in defining what those are. This is going to be, sorry guys, I'm all over the place today. I'm testing out new technology and I'm a little bit frazzled on this side, but hopefully everything's coming through okay. And I will try to calm down and not be so anxious here. Let's start by doing it this way. Okay. Wow, my slides are really disorganized today. We'll jump back to this one later. I apologize. So WISER, this is what's coming for original Medicare, right? And this is the technology that's going to be handling those prior authorizations. And prior authorizations, of course, is when your doctor says that you need something, but then they have to go ask Medicare for permission to give you the thing that you need. I don't know about you guys. I have an autoimmune disorder, so I've had to deal with this a lot with my insurance, and it's always a headache. It's frustrating when you have to, get the approval of bureaucrats and people who are just trying to save money to get the healthcare that you need. So traditionally, pre-authorization hasn't been a big deal with original Medicare. So this is new in that context. The changes are going to start January 1st of 2026, and they are starting to roll this out in 6 states. This isn't going to be nationwide yet. This is just, thank you for saying I'm on a good thing. Sorry. Thank you, Pepsi Cola. I appreciate that. I am trying to get better at streaming more consistently because a lot of you have asked for this, but it still stresses me out like crazy bad to be on here with you guys. But so these changes are going to be rolling out to Arizona, New Jersey, Ohio, Oklahoma, Texas, and Washington. Washington is my home state, so I know loads of people who are going to be impacted by this, which is one of the reasons why I am so stressed out about it. And like I said, they're going to end up rolling this out to more states. This is just the test run. They just want to see if this is going to work. And I think one of the reasons why they're starting more limitedly is because they are this is going to be driven by AI in a lot of cases. I'm not sure what happened to my slides here. I think one must have been marked as hidden because one of the things we read is that they're going to be rolling out advanced technology to evaluate this. And we all know what that means now, right? They're putting AI in everything. And so not only do you have to justify this to some bureaucrat somewhere, you also have to make it through the AI first, right? So the AI is going to be screening and deciding whether or not you need the care. And then they say that all the final decisions will be made by a licensed clinician. Um, that's, I mean, they're still not going to be your doctor, but yeah. So they're starting this in 6 states. They're starting with 17 services that they're calling low value, right? And depending on your medical needs, you may not think of these as low value. These may be very important to you. So I wanted to show you the list of what it is that they're talking about making harder to get. So I'm not going to read all of these. There's a lot of, here, how do I get my face out of the way? There we go. There's a lot of medical words in here that you don't want to hear me try to pronounce. I don't want to try to pronounce. And yeah, anyway. So feel free to take a look at this list. We've got things like nerve stimulators, things for urinary incontinence, deep brain stimulation, all sorts of different things in here that now are going to have to go through this complex pre-authorization process if you live in one of those states. Yeah, I'm just going to leave this on screen. You can also pause the stream here if you need more time to look over this. Let's see. Yeah. So the thing is, though, like I said, the screenings for this aren't going to be handled by your doctor or even necessarily your Medicare company. They're outsourcing this to private companies. They're going to be running it through AI. And in this press release, so this press release right here, I don't know if you guys can see where I'm moving my mouse. That was the thing on the old tech we were using, but we've switched. This press release talks about how these companies are going to get paid, and they're going to get paid based on how much money they're cutting from Medicare, right? How much money they're saving the government, which, I mean, saving money is great, but they're doing that by pre-authorizing and denying services that you may need. So to me, that screams Medicare cuts, right? Because if they're getting, if their financial well-being depends on denying you care, it's not rocket science to figure out how that's going to end, right? That seems not great. Yeah. So the more they say no, the more they can potentially earn, it sounds like, based on the press release that I read. And I find that very, very concerning. Okay, yeah. So, okay, I guess that's the end of the bit about traditional Medicare. Let me see. I swear I missed a slide in here. Sorry, guys. I'm just going to jump back really quick and see if I missed something or if I just, oh, no, I guess I didn't miss it in here. Nope, was that it? Nope. All right. Sorry about that. I will be more diligent when I prepare my slides next time. I got kind of tripped up because stuff seems to be hidden on my end here. It's the joy of testing new technology. On the bright side, if you've been a part of our streams over the last week and I've been complaining about the way that my chat has been jumping around, that no longer seems to be an issue. So so at least that's a win, I guess. I'm so sorry, guys. I appreciate your patience with me. All right, now let's talk about what's happening to Medicare Advantage. See, and this is really interesting to me too, because I've been hearing from a lot of you guys who have been feeling like they're going to be pushing more and more people toward Medicare Advantage. So while they're implementing new pre-authorization requirements in original Medicare, they are simultaneously easing the pre-authorization requirements in Medicare Advantage, which is really interesting. So about a week before the announcement that they were going to roll out Wiser for traditional Medicare, they also said that they had this great meeting with all of these healthcare insurers. They said that, and I've listed some of the companies here on screen, but they said that the insurers in that meeting covered about 80% of all Americans, and they all agreed to do these 6 critical changes. Okay. And these 6 changes that they're going to be rolling out for Medicare Advantage includes standardizing the electronic prior authorization submissions using this new application. They're going to reduce the volume of medical services subject to pre-authorization by January 1st. So this is really interesting, right? Because January 1st, original Medicare is going to start requiring more pre-authorizations, but also on January 1st, Medicare Advantage is going to start requiring fewer of them. So that's some interesting timing right there. They also said that they're going to honor any existing authorizations during the transition to ensure continuity of care. I apologize. which means if you've got an authorization before these changes are supposed to take effect, they still need to honor those. They're not just going to, revoke whatever they've already given you there. Let's see. Okay, yeah. So the rest of them say, enhance transparency and communication around authorization decisions and appeals. That would be nice, right? I know a lot of times when insurance decisions are made, it is about as clear as mud, and it can be hard to know why it was denied or what you can do about it. And so improving that transparency will be a really good thing. They're also going to expand real-time responses to minimize delays for most requests by 2027. So that's not something we'll see immediately, but hopefully will be coming very quickly. And those real-time approvals, I'm assuming a lot of that is going to be AI driven as well, because AI is just simply faster than human beings can possibly be. And then this one also, they're going to ensure that medical professionals review all clinical denials. That is really important, that someone who's actually licensed in some medical way make those final determinations. And so that change will be coming to Medicare Advantage. That change is also part of the new Wiser program that we discussed on traditional Medicare as well. So it looks like all of those final decisions will be made by someone who has at least some sort of medical licensure. I have seen things with other insurance companies where maybe the medical professional isn't licensed in maybe the way that is most relevant to the decisions that they're making. So still kind of cautiously optimistic with what this could mean. But at least it's a step forward over having it be like a lawyer making the decision, right? Where they're just looking for reasons to deny you. Of course, that's all my own opinion. I I have some strong feelings about how insurance works because I have some medical issues and I've got some experience with that. And it's just, I feel for anybody who has any sort of chronic medical issue because it's just a challenge. Um, all right, what else we got? We're getting to the end of the slides here, and then I'll see if I can take your questions. Yeah, okay, so this going along with the Medicare Advantage conversation. Nope, sorry, this is a wrap up. I'm jumping all over the place today. Yeah, so I think we covered all of this. And okay, what do we got next? I really need to go over these slides a little better before we jump into these lives. I thought that I had it so that I could just hop in here. Oh, please don't break. My technology is breaking now. This is not useful. Okay, yeah. So cool thing. You guys know by now that we partner with Chapter Medicare, and I love that because they know a lot more about Medicare than I do. And so they have offered the low income relief audience a free copy of their best-selling book on Medicare. So this is the number one Medicare book on Amazon. It's a bestseller there. Normally sells for $10. You can grab a free copy now if you go to this link that you see on screen. That will take you to the landing page. You just put in your name and email address. It'll email you a copy of the book. That does also subscribe you to email alerts from Low Income Relief as well. You're welcome to unsubscribe anytime. If you're just grabbing the book, I totally get it. No harm done. I know that people these days get notifications about everything all the time, and I don't want to be, sending you emails you don't want, but it is a great way to go ahead and get a free copy of that book, save yourself $10 and get some really good insights on, you can see here in the subtitle, the 3 Medicare decisions to protect your health and money. So definitely go check that out. And I think that brings us to the end. Yep, that's just the same thing about talking to Chapter. So, all right. I apologize for the slow start in today's stream, guys. I am really good at tripping all over my words. But if you have any questions for me, I do have the chat up here, and it does appear to be behaving better than it has in the last couple of times we've tried to stream. So let's see, I'll jump in here and see. Oh, and of course, having said that, it decided to refresh and everything disappeared. So that's cool. Beautiful Sunrises says AI has no emotions and can care less what people need. It's so impersonal. I completely agree with that. There's a lot of nuance to a lot of things that AI can't really capture. I use AI a lot more often than I thought I would because I do marketing for different businesses and different things in addition to running low income relief. And it's useful in a lot of ways, but I'm not sure that putting it in charge of people's healthcare decisions is a really great choice. Okay. Delcy says, who determines what is low income? Anything to increase profits off the backs of people. Yeah. So that was one of my first red flags too, right? Whenever I'm reading these press releases and I'm seeing these changes that people are talking about, anytime you see any sort of vague terminology, it kind of sends up red flags, right? So in the short term, when they're testing out how this new AI system is going to be working, they're going to limit it at first to, let's see if I can find the slide again here. These 17 services in the 6 states that we listed are going to be what they're calling, what they're going to be screening for under Wiser. It is expected to expand. This is just a test. They said the test is going to last like 6 years. But I also saw, I think on the Federal Register website, which is a government website, that they're also still accepting applications for the Wiser expansion. So I don't know if it is just limited to those 6 states or if those are the only ones that have been approved so far. So that is a really good question. Anytime that anybody anywhere is messing with major benefits, testing changes to Medicaid or Medicare, or anytime we hear about anything happening with Social Security, I feel like those changes are really important for everyone to know, even if they aren't happening in your area yet, or even if they aren't happening to your medical condition yet, because that's a pretty solid indicator of the direction that things are going to be going, right? And what could be happening. And if you stay ahead of the curve and you stay informed about these things, it gives you a great opportunity to reach out proactively to your elected lawmakers and make your voice heard and try to influence change if it's something that you don't agree with, or if it is something that you do agree with. And that's definitely not something you can do if you don't know what's going on, which is one of the reasons why I try to hop on here and make sure that you guys know what all is going on. So I will get off that soapbox and hop back in here in the comments and see what's going on here. Okay. Starlight asks, will Medicaid still cover premium costs for disability? It should, even with the Medicaid cuts that were just passed as part of that big bill legislation. You don't have to meet the work requirements or anything if you're on disability. So I don't anticipate any changes coming to how Medicaid handles those premium costs. If you have any concerns about that, I would definitely reach out to Chapter. They specialize in helping people who are dual eligible, which means you get both Medicaid and Medicare, because there's so many different plans out there and so many different ways that these programs can interact with each other that they said, actually, here, let me grab this slide. I was talking to the people at Chapter the other day, and they said that on average, seniors save like $1,100 by just making sure they're on the right plan. So that may be something that you want to check out just to be sure. Let's see. Rhonda's talking about a data leak that happened with Aetna Insurance. A lot of them have been hacked. It feels like data breaches are happening all of the time, but definitely if you have concerns, it's always worth finding a new plan and a new provider. Let's see. I haven't seen Begonia. I don't think I saw joint replacement surgery mentioned as unnecessary anywhere. That still seems like something that would be very, very necessary. Let's see. Victoria is asking, is the new bill going to affect Medicare extra help, those other things? I read over the legislation and it's 940 pages long. So there's a lot in there. And I did see some things about Medicare, but the stuff that I saw in there was mostly about, like immigrant statuses, things like that. I didn't see anything that would necessarily cut those Medicare savings programs. I did see that they are postponing some of the rules that were designed to make them easier to get. There was some new legislation from about, I think, like a year ago that was supposed to go into effect, that was supposed to streamline, like, well, if you're dual eligible, then you should automatically get these things and we should automatically enroll you. And they're not going to be acting on any of that. So there's still going to be loopholes you have to jump through to get all of those things. But I think they should still be available to you. Amanda says, looks like I missed a lot. So this live started at 2:55. It was supposed to start at 2:15. I have had a heck of a day, as you can tell by my anxious, slow start to this video. I'm still trying to pin down the best time to start our videos. We used to start at 3 o'clock every day, like clockwork, or sorry, on Tuesdays, Thursdays, and Saturdays. And then I found out that there is another YouTuber that goes live at that time. So I've been trying to adjust my schedule to accommodate for that. So we're not in conflict there. But sometimes I don't get my stuff done in time and I run late. So I do apologize for that. I am definitely trying to improve the consistency of our schedule here. Pepsi Cola says that she or that they thought that I worked for the government. I definitely don't work for the government. I never have worked for the government. I did used to work as a journalist, and I just really enjoy research and breaking down information in a way that's easier to understand. And for many personal reasons, I have a particular passion for helping low income people find the resources that they need. And when I went through my financial crisis years and years ago, when I thought we were going to be homeless, there wasn't anyone to help find things. And that was really difficult. I spent hours and hours trying to find things. And so now my hope is just that I can make it a little easier for you to find what you need. So I really appreciate this comment. This made my day. I'm going to write this on my wall up here. I have a wall of sticky notes where I put things that help keep me going. So yeah, Nalu says, I just love the fact that the people making these changes will never be affected by them. And yeah, I agree with that. It seems more and more as time goes on that most of our lawmakers have absolutely no experience with the programs that they're writing rules for. And that's really hard. That is a really hard thing. I think having some perspective there would be very worthwhile. Let's see. Will Humana cut a grocery card? So this is where I refer people to Chapter because I didn't know this until the people at Chapter reached out to me. But there are over 20,000 different Medicare plans in America, which explains why I've never been able to figure them all out. But they have all the information on which ones offer which benefits, and they can talk you through one-on-one everything that you need to know to make a good decision about how to get the most out of your benefits. So definitely would refer you there for that. So Catalina says changes to Medicare over the years has never affected those that use it. You know, there's so many different types of changes that come out, and I follow the press releases directly from CMS, the Centers for Medicare and Medicaid Services, and a lot of them don't look like they're going to affect people that use it, right? A lot of the announcements and the changes that they make are things like provider payouts, which may affect you if your provider decides to stop taking your insurance, but isn't going to be something that's in your face necessarily. And so I try not to cover those changes necessarily because they aren't as impactful. I try to watch for the big things that are going to have a big impact. And for the people who need the 17 services that were listed in this slide deck, in the 6 states that were included in the test pilot, there is going to be a tangible change for them when this goes into effect. And so, yeah, I just felt like that was important. Okay. Oh, I love this comment. It's like a parenting class. It's like being a parenting class teacher, but never having children. That's exactly what it feels like when we see these very wealthy people rolling out changes to these low income programs. They don't have experience living on them at all. Let's see. Okay, Kathleen says, what about seniors on Medicare with cancer? Unless you needed one of the 17 services that were listed in that slide we covered earlier, this change probably isn't going to affect you very much. Again, I'd refer you to Chapter to make sure you're on the best Medicare plan, but also please go to lowincomerelief.com because depending on the type of cancer, there are all sorts of different hardship grants out there that can help with critical expenses. I have had family members go through cancer who didn't know about any of those things. And so whenever I see somebody mention cancer, I really try to get the word out about those because there's all sorts of different charities out there that may be able to offer you additional support beyond what Medicare can do. And all of that information is available on our website at lowincomerelief.com. So, oh, you know what? I'm going to hop back to this slide about the book so that anybody just now jumping on can grab that. I feel like that's going to be really helpful for a lot of people. Um, yeah, this is my concern too. Delcy says some medical professionals will just rubber stamp AI decisions, especially if they don't have a lot of expertise with your particular issue. Yeah, and that is, I mean, that is always the concern, right? Pre-authorizations are so frustrating because I've been through this, when I had to have my wisdom teeth out, I was still on Medicaid, and luckily I lived in a state where dental was at least covered. So we knew, when I went through that, we knew that Medicaid would pay for the extraction, but the dentist straight up told me, they're like, you know what? Medicaid's never going to pay for the anesthesia, right? They're just going to pay for the extraction. And I'm like, okay. And I was in so much pain, and I was on antibiotics and had been infected a couple of times. It was so painful. And I'm like, okay, so I will find a way to borrow the money to pay for the anesthesia. Let's just do this. And they're like, oh, no, 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 because the state requires you to ask them to pay for the anesthesia before they'll say no. And we have to have them say no before we can schedule the surgery. And then it's going to be like 3 months. And it ended up taking like 4 months for this whole process to work out, because we had to go through these ridiculous pre-authorization hoops that everybody knew weren't going to work, but we had to check all those annoying boxes to be able to get to the point where I could actually get the help that I needed. And so that's one of the reasons why reading through all of this and seeing these, pre-authorization stuff just kind of scares me a little bit for you guys, right? Because I don't have Medicare yet. But I know from my own experience with Medicaid and with other insurances that I've been on that it's just hoops, and a lot of times it doesn't make any sense, and it almost always creates that delay, which I was in a lot of pain, but it's not like I was in any danger or anything. It's just anyway, I could go on and on about that. Let's see. What else do we got here? Rhonda's asking, do you know if they're going to have cheaper prescriptions anytime soon? I know I've seen, prescription adjustments coming out here and there. I do have another video. I think it's either on this channel or on the Fast Facts channel about how to get cheaper prescriptions. There are all sorts of programs out there that can help with that, including, obviously Medicaid can help cover prescriptions, but also there's prescription cards that can help you save money. There's manufacturer programs. There are so many different things out there, and a lot of people don't know about them. So if you'll permit me to tell one more personal story, I have an autoimmune disorder. And I have to take a medication that, I kid you not, costs, I think the last time I checked it, it was $17,000 a month or something like that. It's an insane amount of money. Luckily, I guess that's per dose. I don't have to take that many doses every year. Anyway, it's a whole thing. There's costs a crazy amount of money. And when I went to my insurance with that, they're like, oh, no, 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 we're not going to touch that, because of the way that my doctor had written it. And it turns out that they did offer the same medication, just in a different dispenser. So sometimes asking your doctor to adjust your prescription, talk to your insurance company, see what they have, what they offer. Because once I was told no by the insurance, I just accepted that for a couple of months. And then I found out later on that, oh yeah, if I had just said the right words, I would have been able to get it at no cost. So I always recommend following up, asking a lot of questions, and checking out that other video we have on how to save money on prescriptions, because there are a lot more options out there than people think. Let's see. If you aren't on the right plan, when can you change it? This is a great question. So I have learned so much about Medicare since I started working with Chapter. And, full disclosure, I know it sounds like one endless commercial, right? And I never want you guys to feel like I'm doing that to you. I have always had a hard time with Medicare because it's so convoluted. And working with Chapter has made it a lot easier, because I can email them and I ask them questions all day long, and it's fabulous. So you could seriously call Chapter right now. I think it's still their business hours. And talk to them, and they should be able to help you coordinate that if you're dual eligible. If you're not, and you have to wait for one of those open enrollment periods, you may have to wait till October. But yeah, if you're dual eligible, you have a lot more opportunities, which is, nice. Let's see. Yeah, I'm seeing a lot of you talk in the comments about how you feel about these changes, and I definitely agree. with a lot of what is being said here. Before we wrap up, does anyone have any other specific questions you'd like me to answer before we jump off? One of the downsides to the new technology we switched to is that I do have a time limit on how long I can be on a stream now. But at least I can actually read the chat. So that is awesome. Yeah, okay. Oh, thank you, Wendy. I appreciate that. I try really hard not to I don't want to bore you guys. But yeah, I do appreciate that. Let's see. Oh my goodness. Yeah, I'm sorry guys. I know that our last couple of streams here have been pretty honestly pretty depressing, right? With all the changes that are rolling out and the cuts and the things that are being considered and talked about, and it's a scary time to need help. And that's horrible. And I wish that I had better news for you. I For those of you who are still here with me, I am going to try to switch to a more consistent schedule. I've been historically, we've put out videos every Tuesday, then we kind of went to Tuesday, Thursday, Saturday. I still feel like that's not enough, right? I don't want to be filling up our schedule with negativity. And if I'm going to have time to both convey what's actually happening in the news to you and also try to get you more helpful resources, we probably need to be streaming more frequently. So I'm hoping to go to something closer to a daily schedule if I can swing it, um, as long as you guys are willing to put up with how bad I am at this. Okay, TT says, I worked for Medicare for 28 and a half years. Part A is more complicated than B. You may also be able to change plans if you move. That's also true. If you move or relocate, you also have an opportunity to change plans. And then also, I forgot to mention, when you're coming into Medicare, based on your age, there's also a window there where you're allowed to enroll and make changes. Oh, Pepsi Cola, you are the best. I really appreciate you. Your comments have definitely helped keep me going today because I feel like I was a bit of an airhead there at the beginning of this. Let's see, Joanne. Yeah, I am also very sad for elderly and retirees. You would not believe how often Stephanie and Kat and I are in the comments trying to moderate out everyone who's like, oh, well, just go get a job, because that is so not an option. I think for most of the people on this channel, it's when your options are limited, it's so hard. And I am definitely sad and concerned. I'm going to highlight this too. Also, yeah, no asking for meds in my stream. Like, just don't do that, please. If you can't afford your prescription, please go check out our video on how to get free meds. Let me see. I could actually probably pull that link for you really quick too. Let's see. All right, here. I'll just put the link to the website down in the chat as well. Sorry for plopping it in there with zero context, but that should help you if you're looking for help getting medications. Let's see. All righty. Oh yeah, I love this tip too. There are all sorts of programs out there, and your pharmacy will usually know at least about most of them, if not all of them. All right. Oh, thank you. I'm so glad that you found the channel. I really appreciate that, Living Right. That's awesome. You're welcome. Thanks. And let's see. All righty. Been fighting for 4 years. Good for you for keeping up the fight, because I know that it can take a really long time to get those benefits. I didn't see anything yet that could possibly affect that. I know with the budget reconciliation process that they used for the one big beautiful bill, they weren't able to touch Social Security with that. I believe it was the Senate parliamentarian that told them no on that. It's just a rule of the process that they chose to use. So that at least won't be an issue. Let's see. Alrighty. What's true about Ohio Medicaid? I would have to do a lot of research to figure that out, because state-specific information is really, really difficult. But if you guys would like to see another video about Medicaid, I'm happy to put that together. But I'm going to need some more specific information about what you're asking. So, all right. It looks like the chat is slowing down a little bit, and I'm not seeing any other questions I can grab out of here. So, couple of things. If you have any tips or questions or inquiries, you can always email our team at tips@lowincomerelief.com. We do try to follow up as best we can on those questions and get the research done. I do prefer to research your questions and then bring them to you in a video so that I know I'm giving you the best possible information here. Joan says, isn't Medicaid the same everywhere? The basic part of Medicaid is there are federal requirements about what states have to provide. Some states go above and beyond that. For example, when I lived in Washington, dental was part of Medicaid there. That's not true in all areas. Sometimes they make different income limits, things like that. So there is a little bit of flexibility, which makes me hesitant to answer any state specific questions definitively. All right. So I am going to go ahead and sign off for today. I really appreciate you sticking with me through all of this. I know the beginning was a little bit crazy. You are all wonderful. And I will try to come back tomorrow with more answers for you about what is going on. So have a wonderful day, and I'll see you again soon.